Hi, my name is Stephanie and I'll be doing the introduction for Group 8. In this video, we'll explore how pediatric nurse Jessie can help support two parents whose 3-year-old has been diagnosed with type 1 diabetes mellitus. This topic is essential in nursing because therapeutic communication and counseling approaches help family adjust to life-changing diagnosis with empathy, hope, and understanding. Our scenario highlights two evidence-based counseling approaches, that is person-centered and solution-focused therapy. Together, these approaches promotes emotional support, empowerment, and collaboration in family-centered care. Person-centered therapy, developed by Carl Rogers, emphasizes empathy, unconditional positive regard, and genuineness to build trust and acceptance. Rogers noted that the therapist's knowledge is secondary to the relationship built with the client. In this video, we'll see Nurse Jessie actively listening to understand the parents' concerns about their child's new diagnosis by providing a supportive, non-judgmental space for them to express their emotion. Solution-focused therapy, on the other hand, emphasizes on identifying strengths and creating realistic, achievable goals. By helping the family set small, meaningful goals they can achieve together, Nurse Jessie can foster a sense of progress and confidence despite the challenges of the new diagnosis. Together, these counseling approaches guide nurses in supporting families in practical and emotional aspects when navigating a chronic illness in a child.
Hello. My name is Jesse. I'm going to be the nurse talking to you today. Nice to meet you.
Nice to meet you, Jesse.
Nice to meet you.
Nice to meet you too. So I'm here to talk to you guys about your son. I heard that he had a recent diagnosis of type 1 diabetes.
Yeah, it's been really hard for us, honestly, because he's only 3 years old and it just feels like everything changed overnight. It's so overwhelming for us right now.
Yeah, I don't even know where to start. How do we manage something like this? We don't know.
Olivia here. As you can see, Nurse Jessie is using the therapeutic communication skill of active listening. You can tell based on the way he is maintaining eye contact with the parent that is speaking, nodding along while they are expressing their feelings, etc. This is very person-centered, as the therapist experiences unconditional positive regard and empathy for the client's reference point. This is helping the parents feel seen and validated, helping them open up throughout the session.
It's understandable that you feel this way. This is some pretty real information that you just received about your toddler. What's the hardest part that you've experienced so far? You can take your time to collect your thoughts.
Yeah, I think for us it's his insulin administration, because I don't think we know how to do that, and I'm afraid it might cause some harm to him, and I might just hurt him by trying to administer his insulin.
I understand.
Another thing is Phil's a kid, I'm worried about his daily activities. How will he play in daycare? And how will the caregivers even know how to do insulin? So it's kind of scary thinking about that.
Right. I think those are very real fears that you both have about Phil.
Olivia here. Nurse Jessie is currently demonstrating the communication skill of reflection. He is repeating the emotional meaning behind what the parents are expressing. This reflects person-centered therapy, as one of the conditions for a growth-promoting climate is accurate empathetic understanding, which is helping the parents feel more connected to Nurse Jessie.
Sounds like you guys have really great instincts in protecting your son. What's a difficult scenario or a situation you found yourself as a family in, and how did you deal with that?
I remember last spring when we had allergy symptoms. We kind of handled that pretty well with his inhaler. So we were able to start a routine, and we followed that routine for his asthma last spring.
Okay, so you're saying you found routine to be kind of the key factor of that scenario. Do you think routine would benefit in the management of the type 1 diabetes?
You know what? I think so. That the routine actually really helped us.
Yeah.
And also getting used to using the inhaler and stuff.
Mm-hmm.
So maybe we can do that again with this new issue we have.
Yeah.
I I think we can totally do that. I think routine is very important in insulin administration and the management of type 1 diabetes. I think we should move forward with that.
Olivia again. Here, Nurse Jesse is using a mix of both person-centered therapy and solutions-based therapy. He's asking what has worked for these parents in the past and seeing their perspective, as well as developing a small, achievable goal for the family to start planning out. In the article, A Person-Centered Intervention for Providing Information to Parents of Children with Cancer, parents in this article expressed that they received good medical advice about their children's chronic illness but lacked an advice about the impact of everyday life of the child and family. Nursing staff implemented person-centered interventions focused on listening and answering specific questions the parents asked. The results were parents expressing increased satisfaction with hospital staff and felt as their questions were much better answered. This is also a great use of the therapeutic communication skill of affirmation, noting that the parents' examples are great. This is useful in giving the parents more confidence in creating a plan to help their son in this new journey.
So thinking about the next few weeks, what's something that you think that will really help Phil's care?
Because we're not too sure about how to administer his insulin, I think getting someone like a professional to teach us how to do that would be really helpful.
Mm-hmm. Yeah, I think so too. And again, like the routine, again, we did it before and it worked pretty well. So maybe we can do it again, the insulin administration and stuff like that, and get used to doing it for him.
Okay, so it sounds like insulin administration is causing some anxieties towards Phil and his care. I think we can absolutely schedule a meeting in the future where we can go over insulin. I'll make sure you guys have all the information that's available on the unit towards insulin administration for a pediatric patient, and then we'll move forward from there.
Oh, that'll be nice.
That would be great, yeah.
Olivia here. Nurse Jessie is using the solution-focused therapy to create small goals for this family to begin, to help them in the near future. Nurse Jessie is using the communication skill of setting goals. Research done by Lee et al. Shows that positive family coping styles like setting achievable, collaborative goals can help families resist crises and promote healthy recovery of family resilience. This can help reduce their parental anxiety and improve insulin treatment adherence.
I just have a quick question.
Okay, go ahead.
What is a common question or a common topic that like parents ask you in cases like this?
Great question. So a common question that parents with a child that has type 1 diabetes, they'll often be curious about nutrition. Your son will still be able to eat most of the foods that he likes and he enjoys on a regular basis. It's just more about the timing of insulin and when he receives that insulin with carbs and sugars.
So what do you mean about like carbs? Because I heard, from what I know, diabetes is all about sugars.
Right.
And not too much sugar, or he can't take that much sugar or something.
Yep, and sugars are very involved. So carbohydrates and sugars both get broken down into glucose. And glucose is our main concern with diabetes, and so insulin helps glucose gets into the body, gets into the cells. When we have an excess of glucose, that's when we'll see blood sugars be pretty high, and that is an undesirable outcome for your son.
Okay.
So we don't want him taking excess.
Excess. So yeah, and like monitoring his blood sugars is very key in this scenario, and the timing of when you give insulin before meals.
That's gonna be a pretty big change.
It will. Yeah, but
I'm not
it's
really sure if we're gonna get used to it, so do you have any recommendation for us?
I think it will be a big change at first, but you'll be able to adapt, and insulin for diabetics kind of becomes a second nature. Type 1 or type 2, it's just they're a new reality that settles in, and they can still live a great and happy life with that diagnosis.
Okay.
Well, I'd like to learn more about this stuff, so there's something we can, as you said, the pamphlet earlier, something else like that.
Yeah, absolutely. There's actually a group that meets on Wednesdays. It's all parents with diabetic children. That might be a great resource for you guys to attend that on Wednesdays if you choose to.
Yeah, we could see how we fit that in our schedule. Yeah.
Here, Nurse Jessie is implementing a collaborative solution-based approach by answering questions using past experiences and his own nursing knowledge. Collaboration between the parents and the nurse regarding information created a shared goal setting to be educated in the topic until they are comfortable and relieved of their anxieties. In the article Solution-Focused Coaching in Pediatric Rehabilitation, it is found that the collaboration between parents and nursing staff is essential to be successful in rehabilitation. The open dialogue and being able to ask questions back and forth creates a shared goal and is key to this theory.
You folks are doing a great job when it comes to approaching this with your son. Just know that you're not alone and that we're here to help you. The team is here to help you, and that we can move forward to get what the best outcome is with your son.
Thank you so much. Honestly, I feel a lot better. I'm sure you're feeling better too, right?
I'm still a bit anxious, but I think we got this.
Yeah, I think we got this.
Awesome. And after all, you guys are the experts when it comes to your son. So you can be really involved with the direction of your son's care involving his diagnosis. And know that you're supported by me and the team here, and that we're gonna get there. There's always the light at the end of the tunnel, and we're gonna get to the best outcome.
Thank you so much.
As you can see here, Nurse Jessie is beginning to close the session with the therapeutic communication techniques of summarizing and reassuring. This is helping build that last little bit of empathetic relationship between the parents and Nurse Jessie, aligning well with person-centered therapy. Summarizing and reassuring help the clients feel comfortable with how the session is ending, ensuring they have all of their personal questions answered.
So now that we've talked a bit, how are you guys feeling compared to when we started to talk?
Well, it feels a little less impossible now. We got to know more about type 1 diabetes and what we can do for Phil. And yeah, pretty sure we can just stick to those routines and what you meant earlier.
Also, knowing that we have help from you and we can reach out to the resources you're offering us, I think we can be able to manage this once we are able to figure it out. Yeah.
Awesome. I'm so happy to hear that. I think we're making steps in the right direction, and I would love to schedule a follow-up meeting next week. How does that sound?
Yeah, that should be good
Sounds
for
great.
us.
Great.
Thank you so much.
You're very welcome.
Thanks so much, Jesse.
Thank you.
Through this video, we saw how combining both person-centered and solution-focused therapy help the nurses build trust, promote hope, and also empower these families to express their emotion and also set realistic goals for them to achieve in the future. Person-centered therapy helped Nurse Jessie create an empathetic and compassionate environment where the parents felt truly heard and understood. This approach gave them a space to explore their feelings while also letting them take an active role in creating their own goals throughout the counseling process. Solution-focused therapy helps to shift the family's initial emotional distress into recognizing their own goal, developing achievable goals, and also fostering optimism for the future. By integrating therapeutic communication skills, Nurse Jessie was able to encourage meaningful engagement, collaborations, and confidence in the family's ability to manage their child's condition. As future nurses, applying these approaches would help us deliver holistic, family-centered care that supports both emotional and practical needs of patients and their loved ones. Ultimately, this strategies allows families not just to survive new diagnoses like type 1 diabetes, but also adapt to growth, thrive through their health journeys. Thank you for watching.